Here are 10 symptoms of high blood pressure you should never ignore. And make sure you watch and pay attention to the last symptom because it may be the most important. Symptom number 1, headache. When you have hypertension, headache or even pounding in the ears can be a symptom. When you have hypertension, especially if it's very high, you can have an elevated pressure within your brain. You can have elevated pressure pushing against the arteries within your brain, and this can cause a headache or even a sensation of pounding in the ears. Number 2, blurry vision. Blurry vision or change in vision can also be a symptom of hypertension. In your eyes, you have retina. They're in the back of your eyes, and they have many small blood vessels. When you have very elevated blood pressure, especially chronically, then these vessels can be damaged or compromised, and you can get something called hypertensive retinopathy. These tiny blood vessels in the backs of your eyes can even bleed, and this can lead to blurry vision. You can also have an increased pressure in your eyes related to the hypertension, which can cause blurry vision. And if the blood flow to the retina happens to be compromised, or even if it stops, then you can actually have a loss of vision. So blurry vision is another potential symptom of hypertension. Question: how many of you have been diagnosed with hypertension and in hindsight you had symptoms but did not even realize that those were symptoms of high blood pressure? Please comment down below. Number 3, fatigue. Fatigue or excess tiredness or even confusion can be symptoms of hypertension for many reasons. When you have hypertension, it can compromise your heart or the way that your heart pumps blood and oxygen flow to your body. This certainly can cause fatigue. You can also have a compromise of your lungs or the way that you oxygenate, which again can cause fatigue. And certainly you can have neurological symptoms related to the high blood pressure, again causing fatigue. So fatigue is another potential symptom of hypertension. Number 4, chest pain. Chest pain can certainly be a symptom of hypertension, as hypertension is a leading cause of heart attacks or heart failure. When you have very elevated blood pressure, it can compromise the blood flow to your coronary arteries or your heart arteries, and it can lead to a heart attack or myocardial infarction. If this happens, most certainly you can have chest pain. So chest pain can be a symptom of hypertension you don't want to ignore. Number 5, weakness. Weakness can certainly be a symptom of hypertension, especially if it is focal weakness, because that could be an indication that you've had a stroke or a cerebrovascular accident. Hypertension is a leading cause of strokes, so if you have facial drooping, arm weakness, leg weakness, that could mean that your high blood pressure has led to a stroke or neurological compromise. So weakness can be a symptom of hypertension. Number 6, nausea. You can have nausea and or vomiting as a symptom of hypertension. It can be for a number of reasons. You can become nauseated as a result of an increased intracranial pressure. For example, if your hypertension has caused some of the vessels in your brain to erupt, then you can have a hemorrhagic stroke, which can cause an increased pressure within your brain, and that increased pressure can trigger nausea or vomiting. Also, if your hypertension has caused you to have a heart attack, then one of the atypical symptoms of heart disease can be nausea and vomiting. So, symptom number 6, nausea and vomiting can be symptoms of high blood pressure. In order to learn ways to lower your blood pressure naturally, make sure you watch my YouTube video after you finish watching this video. Click the link in the description. Number 7, shortness of breath. Shortness of breath can be a symptom of high blood pressure for many reasons. You can have shortness of breath due to a heart attack from high blood pressure, shortness of breath due to pulmonary edema or excess fluid in the lungs, which can be related to elevated blood pressure. Also, you can get shortness of breath if the hypertension has led to heart failure, which causes an inadequate pumping of the blood and leads to a backup of fluid in the lungs. Again, pulmonary edema. So shortness of breath can be a symptom of high blood pressure you should never ignore. Number 8, back pain. That may sound odd, but yes, back pain can be a symptom of hypertension you should not ignore. High blood pressure can lead to an emergent, very serious phenomenon called aortic dissection. That's when the aorta is compromised in a way where you start bleeding into the wall of the aorta, and this can be fatal. Very elevated blood pressures can trigger aortic dissection, and one of the main symptoms of aortic dissection is back pain. So yes, back pain can be a symptom of high blood pressure you should absolutely never ignore. Symptom number 9 of high blood pressure, nosebleeds. Albeit rare, a nosebleed can be a symptom of high blood pressure. You have many tiny blood vessels within your nasal airways, and if you have elevated blood pressure, it can damage these vessels, and when that pressure is high, when that force against these arteries is great, it can cause you to have a nosebleed. So a nosebleed is a potential symptom of hypertension you should never ignore. Finally, symptom number 10 is probably the most important symptom of hypertension that you should realize. Symptom number 10, drum roll please. Nothing. Nothing. Most people actually have no symptoms whatsoever of hypertension. This is why they call hypertension the silent killer. So you can have extremely high blood pressure, even blood pressure in the 200s over 100s. And if your body has compensated, if you have become used to living with dangerously high blood pressures, then you can walk around with absolutely no symptoms whatsoever. The frightening thing about this is that a lot of people feel that because they don't have symptoms when their blood pressure is very high, they think that perhaps high blood pressure is what is normal for them. Well, I'm here to tell you this could not be farther from the truth. Even when your body has compensated and you are having no symptoms with your high blood pressure, elevated blood pressure, hypertension actually, can still cause damage. It can still cause kidney failure, still cause heart attacks, still cause heart failure, still cause strokes, still cause death. So hypertension is not normal for anyone. So a very important symptom is symptom number 10 of hypertension: nothing. Be sure to follow up with your physician to learn your risk factors for hypertension and to be monitored. And if you have not done so already, please subscribe to my channel and be sure to share this video with the people you care about. Also, be sure to follow me on Instagram. That's at dr.frida. Meanwhile, be sure to do your best to live your healthiest, happiest life. I'm Dr. Frida.